Before we get to the questions, I also would like to thank the people who really made this conference happen, which is really not us. We had several conference volunteers who continue to do to help us as this session goes on, and they include health policy students Matthew Frank, Adrian Gilpy, Karen Layden, Monica Magalish, Danielle Morelli, and Amber North. And we had help from two women who, for very different reasons, are not here today. One is Sean Brock, and the other one is Francesca Holinko. And lastly, this could never have happened without the help of a whole bunch of people at the Global Health Institute, including primarily Nicole Belal, who's standing there, and Jeanette Austin, who has worked with us for many months tirelessly to make all this happen. So let's really, really thank them a lot.
Thanks. Is this on? Microphone's on, yeah? Okay, right. So this is a question to Caspar. You probably aren't surprised. Your view implies that we should treat...
No, it's not my view. It's a view that I was putting
okay,
out.
right. This view,
yeah.
This indeterminate person's view, perhaps, implies that there's a big difference between my just case and my wheel case.
Yeah.
And as I understand it, you would say in the wheel case, all we have are 40 million people with sort of very small complaints if we choose that course of action, namely...
Yeah, I wasn't putting it in terms of complaints. I was looking at it in terms of how, if we don't spend... Sorry, remind me the wheel case. Is it?
Okay, it's the roulette case where it's an indeterministic process,
yeah,
which will then sort of randomly result in one person for certain dying. So
randomly
we know that one person died.
And is the wheel initiated? Is it spun?
If you choose the course of action, then natural processes will indeterministically lead the wheel to spin in a way which will eventually result in one person dying.
And in the actual world, is that what happens?
It is what would happen if you chose that course of action. I mean, you're trying to decide whether to save Bob or to do that which will result in this indeterministic process killing one person.
So I certainly think that if you actually do spin the wheel and that bowling ball goes round the wheel and lands on top of, on Arthur, that will have been very bad for Arthur. He'll be dead. It can't hardly be worse than that.
Right. Okay. Yeah. If you do, then you're trying to decide what to do. Okay. So.
Well, the relevant claim is that the alternative, right, where you didn't spin the wheel, that's not very good for Arthur. It's just quite good for Arthur. Arthur doesn't get hurt, but there's no fact of the matter about whether Arthur would have been hurt had the wheel been spun.
Okay.
So the relevant claim is that if you don't spin the wheel, that's not very good for Arthur. It's just quite good for Arthur.
Okay. Right. So.
Sorry, I just want to.
Sure. So would there be? So you'd want to say in the dust case, right, where if you choose the California affecting course of action, one person we just don't know who will die.
Sorry,
right?
yeah, you have to remind me the dust case
sure.
is...
So in that case, the way to prevent the disaster in the Midwest is to do that, which will result in a cloud of dust descending over Californians. One of them happens to have this genetic quirk, which will mean that he'll die. We just don't know who. Okay. Yeah. Now, if were we to focus on complaints and also take on board what you were saying, what the view that you were espousing or elaborating, the view would imply that we draw a big distinction between these two cases.
Yeah, absolutely. Or if the wheel had Arthur already we just didn't know it. The wheel had Arthur's name on the bowling ball, and it was always going to hit Arthur. And so the process wasn't counterfactually open. So if the process weren't initiated, it would be a fact. If the process had been initiated, then Arthur would have been killed. Then this whole reasoning wouldn't apply. So yes, it's a crucial, the difference between processes that are counterfactually open and processes such that we just don't know their results is very important on this.
Right, and so I want to I just want to argue that there isn't such a big difference between the dust and the wheel case, right? Let's just assume that were you to take the wheel action, then basically that sets off an indeterministic process, right? So it's counterfactually open. And I think that what you would say is, as far as complaints are concerned, if we're dealing in that way of assessing the moral goodness of the courses of action, all we would have are 40 million people with very small complaints.
No, we'd have one person, you set off the wheel, and it lands on this person, and that person has a big complaint.
Right, yeah, so you say if you set off the wheel, okay, yeah, so that's what you're saying. If you set the wheel off, one person will have a very big complaint. But it's totally indeterminate who that person is.
No, not necessarily, because if you actually do set the wheel off, it's not indeterminate at all. There's a guy.
Oh, right, okay. So
it's only indeterminate if you don't.
Right,
what would have happened if you don't set the wheel off? That it's indeterminate what would have happened if you had set the wheel off.
So it seems like so on your view, there isn't really a big difference after all between dust and wheel, because we say, look, if you set the wheel off, I mean, if you don't set the wheel, if you set the wheel off, there will be one person who will have this very big complaint.
Yeah, absolutely,
right?
yeah.
Okay, so
and there'll be another person who also has a very big complaint. Remember, because the guy.
The Bob, you mean the person who?
Oh, sorry, no, sorry, no.
Yeah,
He'll be very good for him. Yeah.
Right. Yeah. So. Right. So I don't think it. I mean, I thought that your view was actually one which had the implication that we should draw a big distinction between wheel and dust, but it seems after all.
No, I think we should. I think that the view does have the implication that I haven't yet completely got sure about the details of the dust case, but it does have the implication that if the process by which the wheel comes to choose its victim were not counterfactually open, that would make a big difference.
Okay.
Because if, for example, if it was just unknown, that process, but it were not counterfactually open, then if we don't do it, we don't set the wheel off, right, then there's somebody for whom that's very good. Namely the person who would have been hit by that bowling ball if we'd initiated the process.
Right.
And so we've done something that's very good for somebody, very bad for somebody else. Either way, we're going to end up doing something that's very good for one person, very bad for another person. These principles don't distinguish.
So
but if you make it counterfactually open, then if we don't set off the wheel, then there's nobody for whom our action was very good. Now, I agree, you could take this. You could say, but how can such a tiny thing make such a big moral difference? And you could take this to be a reductio of these principles. I'm not saying you shouldn't. In fact, I think you should. But that's what the principles imply.
Okay, all right, yeah.
So the last thing I can say is that I kind of take these principles a little bit to heart. And maybe this is all just kind of retrospective making myself feel better. But for example, I don't give to charity very much. I mean, not as much as I should. I don't know. I'm not a terrible person. I'm not a great person either. I don't give to charity as much as I should, doubtless. And I do take consolation in the thought that, there are almost certainly the process by which that mediates my donation to charity and the good effects is counterfactually open. So I take some kind of consolation in the thought there's nobody, right, for whom my action was very bad.
Right. Yeah. Okay.
Right, because there's no even a dying children. Right. It's not the case that they would have been alive had I given that $100 to get charity. At least, unless the charity has done a brilliant job of setting up the causal structure in such a way as to block that. But mostly they don't. In reality, they pretend they do, but they don't. So now, that does. I would feel worse if the charity actually had managed to set up the intricate causal structure in such a way that there was some unknown person who is dead but would have been alive if I'd given that $100 in. That would make me feel worse, and I'd.
Right, and then the question is, well, how much worse would it justifiably make you feel? So, if in the dust case, the one person would actually become would die, but in the wheel case, the one person would become a quadriplegic, would you say, well, actually, we should? I can't actually. I may have got the things the wrong way around, but you can see the point I'm making.
Yeah, no, absolutely. Yeah, you have a choice between.
So basically, you'd say, well, we should do that which results in a death. I mean, it's better to have that process which results in a death rather than that process which results in quadriplegia, given the counterfactual openness. And that does seem hard to swallow.
I'm with you, yeah.
Okay, all right, thanks.
I'm kind of bewildered by the two microphone situation. Some of you might think that we should give equal chances to members of the two groups. I actually don't believe in equal chances as such. So we'll run through this line, and when it's over, I think Dan Wickler is also going to be back. We'll turn to this group, and in any case, it will affect people in the world overall in the same numbers as the alternative would have.
I'm violating my views by speaking next, since I believe in equal chances, but nevertheless, it's not the first time. The question is to Michael. Suppose that we accept your view, and there must be something, I think, right about it, that we sort of enter into morality by empathetic responses, and then we gradually develop more sophisticated views. One of the things we develop too is, we start out with a very narrow group of people to whom we have those empathetic responses, and then one of the things that happens is they extend more broadly, including to people that we don't have, who aren't identified lives to us, people we don't have direct experience with. And people like Peter Singer have argued about the expanding circle and so forth. So that would seem to suggest to me that as our moral experience expands, there would be less weight given to identified lives as we come to realize that, for example, the people in wherever are experiencing the same kind of suffering that someone whose suffering I've directly experienced. They're experiencing the same kind of thing. And then it seems to me I might think, well, there may be a difference in my response in the sense that I directly respond to some of, Eric's next to me, so Eric's suffering. But maybe what I realize is that really I shouldn't be giving significant weight to identified lives, because I've come to realize that all of these statistical lives are undergoing the same kind of suffering, same kind of injustice, and so forth and so on. So it looks like our moral thinking should go in the direction of giving less and less weight to the identified lives.
That sounds a lot like Peter Singer, actually, yeah. Look, it's true, it might be true that we give less weight to the identified lives, and even to the lives of our own children and friends, as we become morally educated and get a broader and broader perspective. But I don't think that the partiality toward the friends, for example, will entirely go away. And I think to the extent that somebody imagines that it has gone away, we're talking about Charles Fried, and I do think we feel that it's not as if the empathy has expanded so that it takes in everyone equally. That's not what empathy is capable of. That's not empathy. So if, Peter Singer once said, I think in a volume dedicated to him, that he was interested in partialism, but until partialists offered a foundation for partialism, which they hadn't done, he wasn't going to take it all that seriously. Well, I took his worries very seriously, and this is an attempt, in a way. So what I'm saying is, if there's an irrecusable partiality, don't call it bias, partiality or preference built into empathy, that will not go away. And I think it's also likely to be in the case of the child who's drowning right in front of you. So my feeling is, that will remain psychologically, and in my terms, morally, a difference between what I want to say and what Singer or you or Charles Fried wants to say.
The other thing that may sort of take the place of direct empathy in some cases, as that circle expands that you're responding to, is guilt as opposed to empathy.
You're right. Now, I should say, I believe that the only guilt we really understand is going to track empathy in a certain way. If I'm wrong about that, then you might very well be right. Yes.
I wanted to thank you three for three fabulously interesting talks. My question is also to Caspar. So I just wanted to raise something for discussion, which I found a little surprising in your discussion of the person affecting way of approaching these two cases. Perhaps the best way of bringing it out is looking at what you say about case 2, but same applies to case 1. So you say, if I head north, this is quite bad for Belinda, but if I head south, this is very bad for Andy. But of course, the difference in badness cannot be due to a difference in outcome or due to a difference in the effect on these people, right? If I head north, Belinda dies. If I head south, Angie dies. So the difference that you detect can't be due to a difference in outcome. It has to be due to a difference in opportunity cost, right? If I had headed north instead of going south, I could have saved Andy for sure. And if I'd headed south instead of going north, I'd only a 25% chance of saving Belinda. And I think that's what underlies your...
So I don't mean to be difficult or picky. I just wanted to understand the case. So
okay.
So in case 2,
yeah.
This is the case where they're all going to die unless I act, right?
Yeah, let's just look at page 2 of the handout.
Yeah.
You have your table here, chances of living in case 2.
Yeah.
So you say about case 2 in the bottom half of the handout, if I head north, this is quite bad for Belinda.
It's quite bad for Belinda, because she's dead.
Yeah, she's dead, where she would have had a 25% chance of being saved.
Like you have to put it in a very careful way. There's a counterfactual conditional probability of 0.25 that if she'd headed north. But if I'd headed north, if I'd headed south, she would have
That's right.
lived.
But so if we look at the table, what explains the difference in goodness is not a difference in absolute outcomes, because Angie is dead if you head south, and Belinda is dead if you head north. What makes the difference for you is a difference in the counterfactual...
what would have happened if you'd done something else?
Absolutely. So my question is just, should a person-affecting perspective, especially if it's embedded in a sort of overall consequentialist theory, really give that much weight to opportunity costs? I take it that consequentialism just says you have most small reason to bring about the best outcome. You have least small reason to bring about the worst outcome. It doesn't say bring about the outcome that minimizes opportunity costs, and it just seems like the two can come apart in certain cases. There could be a case which brings about the best outcome, but which is not the one in which opportunity costs are minimized, and then I just think we should go with outcomes rather than opportunity costs.
Yeah, my idea was that you're focusing on how the act affects people. And the way that we look at how an act affected people is we look at what actually happened, and we look at how things would have been for the person if the act hadn't been taken.
Yeah, which is just to say you're looking at the opportunity costs that performing...
you can put it in terms of opportunity costs, but then... So I was supposing that was the way to judge how your act has affected the person. I was supposing how my act has affected Belinda. Yeah, and I was supposing that what's relevant, according to...
but it's just surprising hearing that from a consequentialist. I just thought you should look at the end state.
No, I don't think it's a very consequentialist answer. I think that the consequentialist is going to focus first and foremost on the outcomes and how good or bad they are, not on whether the acts affected, how the acts affected individuals.
Okay.
But it's just, and I was searching around for a first-order direct, justification for acting so as to benefit the identified person in these cases where the chanciness is not epistemic, but more objective.
No, okay, but
that's the closest, I think.
Independently of the question whether this is, compatible with consequentialism, why do you think it's plausible to focus on opportunity costs in this way as opposed to outcomes? Or was this just a way of seeing how we could perhaps make sense of identified...
So I don't want to hog the time here because
Yeah.
there's a lot of time. But I mean, you know, the question is, at the end of the day, did you hurt anybody? At the end of the day, who did you harm? You know, what were the effects on particular individuals? And there was nobody I really harmed. There was nobody that this was really bad for. There's some thought to that, you know, that the harm was distributed across many people in that sense.
Yeah, I just think, and it's no less bad to die if you had no chance of being saved than if you had, you know, some chance. But anyway.
Okay, so we're not saying that deaths are less bad. We're saying that the alternative is less good. That's what. Yeah. Sorry.
You know, in terms of your fair chances, you're also distributing outcomes in an unfair way, because waiting time's different.
But then, so
No, I think that's insane.
Some people have, actually.
I honestly think it's
that's
insane.
fair.
I mean, I don't, you know.
I didn't actually see when people arrived. So so why don't we we'll kind of do a ping ponging. But
I think I was here first.
Sorry, what?
I was here before anybody was there.
Okay, so the idea was to get to the end of the people who were there at the time. So Dan is the last one, and then we'll do this group.
But you know, we could just debate this for the rest of our time, and that would be fine. Okay, so Caspar, tell me if I got this right. Actually, my question is for Michael, but I'm going to a quick one for you. Do I have this right? I'm very resentful toward two guys, and I'm going to have one bullet. I'm going to assassinate one of them. So I come to whoever you're channeling here, for moral advice. You know, I don't know, I feel bad about it, and so on. You say, well, look, I can give you some great advice here. What you should do is, you should randomize, and that way, you know, instead of just deciding I'm going to get this guy or I'm going to get that guy, you just randomize. And that way, you set up something, emotion's going to kill one of them, but it's random.
Yeah, but then you'll have done, whichever one it kills, your action will have been very bad for him.
Well, it'd be bad for them, but I'm only killing a statistical person, not a real person.
Well, you're killing a real person. He died. It's real.
Well, of course he did, but
I mean, yeah, I mean, he's dead. Sorry, he's dead.
I know that it's just as bad to be dead as a result of a randomizing device, but in terms of, well, I think it's just parallel with the questions you was asking. Wait, here, let me get my real question, which is this. I just wonder whether there's a status quo bias here, and it's I think Dan prefigured this question. Sometimes people, as political scientists, will grade societies around the world along this axis. On the one hand are the sort of the Northwestern Europe, extremely rule-governed societies that tend to be efficient, they say well-administered, uncorrupt, and so on. And then at the far other side, you can't get anything done unless you do some favors and so on. It's all a big favor society. And anyone who has an office of any kind has it because they got favors, and they keep it because they give favors, and that's how the way the whole thing works. Now, the former tend to be much, better off than the latter, but it's hard to know about causation, but anyway. All right, now, in these societies where they're the favor societies, they would think, in fact, from what I've heard, they do think that someone who would deny a cousin or a landsman or a townsperson or, whatever, someone from your fraternal order or your religion or what ethnic group, someone who would deny you a special favor and say, I'm an official, I have to treat everyone impartially, you're some kind of moral leper. Whereas here, anyone who would give in that way is called corrupt. And so the reason that we perceive this differently is that we tend to think that if you have an office, then you should treat everyone even-handedly, whereas they think that if you have a tie to somebody and you deny them special treatment, then there's something really deficient about you. Now, so what we call corruption and they call moral coldness reflects their prior view about what's right and what's wrong, what our obligations are. Now, we think not about officialdom, but just as us as persons. Then, right now, we think that if you're not moved by the plight of somebody that's identified, then you're some kind of moral leper. And if you think, well, look, as a person, I really ought to take a more impartial view and try to help the most people, then you would turn to this person and say, attitudes like yours are going to ruin us as a society. All right, so I just wonder whether we can really distinguish these and whether it really doesn't depend on sort of where we are at a given moment. In other words, you momentarily mentioned a view that, you know, these reactive attitudes and so on, the sentiments ought to be the consequence of rather than determine, you know, your standards of what's right. But maybe the other view was correct if there is a status quo bias here.
First of all, I do think, just your last point, or part of your last point, I do think our moral obligations do depend on where we are at a given point. There may be unjust institutions, and we may have to worry about you know, getting rid of them too quickly, for example. So yes, I don't think there's anything morally untoward about that. There are terrible practices in various countries, and we can do something about them. But a lot of people will be damaged and injured if we try to change the system. We have to be very careful about what we do in those cases. I think that's a sensitive reaction. In other words, that it depends on where we are at a given point, where people's practices are. But as for the status quo bias, look, we think even a senator, right, has reason, maybe moral reason, to favor his own or her own state over other states. And so I don't think that we impose a complete condition of impartiality on public officials. Now you can call that corruption, and you can say, well, that's a mitigation of coldness. But look, I think it's understood that there's going to be a certain partiality. Certainly a partiality vis-a-vis our own country as opposed to other countries. So all of that, I think, is built into morality. I don't think that's corruption. Now, there is just, you know, the worst kind of nepotism and trading favors and money and all that kind of thing that we do condemn, okay? Look, there is a tendency to favor one's own family and to do those kinds of things. That's why we ask members of Congress and members of the judiciary and presidents and vice presidents to take oaths, and judges to take oaths of office. The oath is supposed to counter, okay, a lot of those tendencies. Now, in many cases it doesn't. But where oaths are working, okay, I buy into an expectationist view about where oaths and promises have their moral force. It's a little bit like scandal, except it's much more sentimentalistic. And so I think that if you can give a sentimentalist account of deontology, you can give a sentimentalist account of oaths and promises. I tried to do that in chapter 3 of my book, The Ethics of Care and Empathy. So I do think actually that we do have counterweights in this very kind of theory to those corruptions that you were talking about. Finally, it's wrong, and I probably should have spoken to this issue, I'm glad you brought it up. It's wrong to assume that in the kind of theory that I'm talking about, that the personal relationship is always going to take precedence over larger scale moral consideration. Absolutely not. Look, when Haiti had an earthquake and all that, you know, you may have had money that you were going to use to give your daughter German lessons, okay? And you may think in that case of, look, I really should give this money for that's Miami, for earthquake relief in Haiti. So I think there's a vectorization of moral considerations with your family and the large scale of something and the suddenness of it and the contemporaneity. I think there's a vectorization, and the family and the friends don't always win out.
There are certain real-world processes that are important to society that are conceptualized in terms of statistical persons, such as clinical trials. Now, when I run a clinical trial, some subset of those statistical persons will be harmed. And in harming that subset of statistical persons, they become individuals. They become identified individuals. The problem is that the bias of the identified individual then has a rather unfortunate consequence on policy, so that a drug that could conceivably be of benefit to tens of thousands, hundreds of thousands of people will either be taken off the market or delayed from coming on the market as a consequence of some harm occurring to 9 or 10. Very recently, a trial of 8,300 people was suspended because there was an excess of 9 cases of breast cancer, even though the drug really has nothing to do with breasts. So I'd like to have a comment on that. In essence, how a process that is statistical in its nature, just by the consequence of that subset becoming identified and the bias of the identified individual then coming in, affects policy in a manner that then ultimately harms a much, much, much larger subset of humanity.
Good question. Don't assume so quickly that the kind of view I'm talking about would have those deleterious effects. You see, when you're talking about policy, for example, the victims aren't already identified, okay? So you can speak in a more general fashion. Now you know that once they are identified, that people are in the door of the hospital and all that, there's going to be some tug on the physician. But if rules are set up, you see, in advance, okay, they may, or promises and oaths or whatever it is, you have to follow policy, whatever it is. So I think there's a difference between policy and what happens when you just happen to run across a case. I'm talking about the latter sort of instance. In the case of policy, you aren't yet there on the scene with the victim. So I think the kind of approach I'm talking about can allow, both for policy, that isn't biased in favor of the immediate, because there's no one immediately there, and for, a bias, or what you call a partiality, in the case where someone is immediately there. Now, there is the problem, of course, that, if you are doing the policy and you're saying, no, we're not going to allow anyone to show favoritism in such and such and such and such a case. Let me give you an example. There are famous examples where somebody comes into a hospital and they need a kidney treatment, and they get the pity of the physician, and they get bumped up or down or whatever it is, the waiting list, so that they get the thing. Now, okay, so that would be, you might say, oh, that's a kind of effective view of you. I don't think so. If promises have this weight that I was talking about, because a waiting list is a promise.
Along the same direction, I like to carry on this clinical trials issue. To our surprise, actually, the clinical trial is not that linear. You think of in terms of, the benefit-risk ratio. That's what the FDA, NIH and, people in the field, they always, build upon the, criteria of risk-benefit ratio. How much risk, I get this new medication, new drug development, and how many benefits I get that. And to your surprise, actually, the benefit maybe have short-term and long-term. Immediately, I get a new anti-HIV drug on the market, and we never thought about long-term, say 5 years, 10 years down the road, how much, patient taking these anti-HIV drugs benefit, as well as, they get a side effect. So you need to, evaluate the moral judgment in terms of not just, how much, identified person get harm, or, how many people statistically get benefit, but, in the long term, from a longitudinal perspective, you need to add a time factors, to evaluate, in the ultimacy of the process, how many people get harm and how many people get benefit. So along this same direction, I like to ask a quick question from the wonderful, framing of Caspar. I really like your, handout, and your framing is fantastic and impressive. But I'm not trained as a philosopher. My training is limited to, NIH experience and, biostat and medical training. But I try to convert your, theoretical case into a real case. Not real case, but more near to real life. For instance, like, in the organ transplant, resource allocation may be more relevant to our medical ethics, discussion forum here. And think about 4 patients. Okay, they have couple organs dysfunctioning. So suddenly I get a phone call from the emergency room, oh, someone died from the motorcycle accident. So his organs are fresh from a young, guy already sign up to donate his couple organs. And we all know that, those waiting on the waiting list, say 4 people, they have, 3 organs, dysfunctioning. And we, from the statistic, from the clinical, proven finding, to transplant one organ plus another organ, the chance you can theoretically, stratify as, say, 25% survival, 50% survival, 75% survival. Should we, using this kind of, framework that you propose, with a counterfactual open, should I just let the 3 other guys dying and save one guy by transplant all the organs available, from this, freshly arrived, quote-unquote organ distribution?
I see. And so you're thinking here, what's open if I do save the one guy is not who would get the organs, but whether they would live. The idea is that there's no fact of the matter as to whether they would have lived if I put the organs in them. Is that what's
also
open?
a transplant case, maybe?
I think your case are very close to real life if I use the transplant organ case to, fit in your equation. Because, for instance, you have a case of 25%, chance of living for the rest of the team, sacrifice one person. And for instance, I may transplant a kidney to a person A. I transplant a heart to the person B. I transplant another organ to person C.
And what's the alternative to doing that? Is the alternative to give all the organs to one person?
Yes.
I see.
So you have 2 choices, whether you give all the 3 organs to one single person.
Yeah.
Have that person had a very high chance of survival.
Right.
Compared to those, they have multi-organ dysfunction. I just transfer one organ to each organ to one of those each.
Yeah, that sounds absolutely like a good analog of
yes,
case 2.
It's very close
They're
to
all
real
going to die
life.
unless I do something. I can save one of them in your case by transplanting all the organs.
Yeah,
I can't believe anybody
distribute and
after
get
multiple
the guy
organ transplants is like sure to be better
half
off.
alive.
Yeah, but anyway, let's suppose he was. Or I can do something, namely distributing the organs across people, such that for each one of them,
receive
it's
one
kind
single
of unlikely
organ.
it gives them a chance of life.
Right.
But maybe
but they are not
to make
completely
it truly
cured.
analogous to this case, it would have to be a case where if I don't do it, there's perhaps no fact of the matter as to whether they would have lived if I'd done it.
Right.
But absolutely, yes, that would be an analog of this case. An analog of case 1 would perhaps be something more like a vaccination case. It's like I have a choice between, if you're talking about real-world analogs to these cases, I have a choice between saving one person or vaccinating a multitude of people. And if I save the one, almost certainly one of these other people is going to die of the disease. If I vaccinate the many, then this person's going to die. And perhaps there's no fact of the matter as to which of these people would have died had I not vaccinated them. And that's actually true in vaccination programs. It's one of the funny features of a vaccination program is you're like, vaccination has helped, it's been wonderful. And then you say, who's it helped? Which vaccinated children would have gotten polio had there not been a vaccine program? It may be that not just that we don't know the answer to that question, there may be no answer to that question. Right? So that would be a kind of real-world analog of case 1. Let me...
Everybody get a multi-organ dysfunctioning. So
if I have heart failure, lung failure, kidney failure.
Well, they're not failure, they're just dysfunctioning. They're just dysfunctioning. Say, for instance, they clinical performance may not be, fully, in full function, but maybe, for instance, like the heart may beat, say, 35% of the ejection fractions that, they could, in cases that's real, I'm not talking about hypothetical, I try to just, enrich your wonderful philosophical framework with this, clinical reality that could be happen. My other very quick questions to the Yale professor, our very respectful professor. I like your bipolar, I like your philosophical, propose, but I wonder whether I could humbly change your vocabulary. The bipolar, to us in the clinical community, very sensitive. Could we use bidirectional, or could we use contractile, or can we use covenantal?
So Steve Darwall is sure to accept
yes,
this proposal. Thank you very much. And I also remember that. Do you want to?
I can't accept it. I mean, I understand it, of course, but it's not my term. So.
I was reading the thanks from a list, and I realized that Emily Largent, who helped us today and is in kind of advanced pregnancy, and it's very, very nice of her, was not on the list, so I really want to thank her as well. Should we take a question from the gentleman there?
Thank you, Professor. I came from the real world, actually. I was a college teacher way back in the 80s. I briefly taught social and political philosophies, Western. And in '83, I started working for AID projects in Asia, as well as in other countries. And I still work for projects in the US. This is my 21st year in the US. And I lived in 3 American states: New York, the money capital of the world; Washington, D.C., the political power of the world; and Massachusetts, the intellectual power of the world. Now, this is the starting realities that I discovered. The first question that came to my mind in '83 was, is my theory working? I learned a lot of theories from my Western teachers and mentors, and I said, what's missing in this theory? So I went to the praxis, the practical application of those theories. Based on that experience, as Einstein had said, the best foundation of knowledge is experience, and I'm invoking his power. As well as Socrates said, you only know what you know, as I am invoking Socrates through Plato. My question is, in the context of the real world, does it really matter whether it's identified as statistical lives? In the context of ethics and public policy, is there a disconnect between the policymakers and the people they commit to serve? Thank you.
Between the policymakers and?
The policymakers and the people they sworn or commit to serve.
To serve, right. Well, let me just say one thing about that. So actually this came up in, I think, the first session as well, when Dan was making his argument, or his catalog of 7 arguments that might be given for the moral relevance of the identified individuals versus statistical lives, and then rebutting them one by one. Yeah. So I do think it's important to keep in mind whether what we're talking about is a matter of public policy, a decision by a policymaker, or what the law should be, or on the one hand, versus decisions that individual citizens are making in their own lives. And I think those are somewhat different questions, and don't necessarily get the same answers. So I think that's just an important distinction to bear in mind.
Norm, do you?
Excuse me for not wanting to participate in the unfair distribution system. Oh, I see. Well, I defer to you now. So my question actually is to Michael Slote. I'm a little troubled by the appeal to empathy. If we think that empathy is in some sense a contingent feature of individuals who might have been selected for in other ways and might have had rather different responsiveness to problems, then why is it that you're attributing such importance to empathy in this particular context? I would have thought that a framework for thinking about the justification of behavior or policies or so on would appeal to some other facts about the situation than simply that we happen to have this responsiveness based on these particular patterns of empathy.
Yeah, well, I'm not so sure that it's a contingent feature of individuals, though the degree of it may well be. I think we have to think more about whether evolution could have produced, on some other planet even, creatures who will cooperate and care about each other without mechanisms of empathy. Now, I know a rationalist will say, oh, no, we don't need the empathy. We can get by on rational considerations. I'm skeptical about that, okay? If the rationalist can show you how, okay, we can motivate people by sheer rational considerations independently of empathy, then we have a morality that works for everyone, okay? And we may not need the empathy. But I'm a bit of a skeptic, so what I'm saying is, in the form of that skepticism, I think we have empathy as a very nice mechanism. Now, what happens if there are creatures on other planets who don't have empathy? What do we say? Well, I think there's no reason why we can't judge them morally. I mean, it's like there may be tribes or groups, I think Mundugamore was one that they used to talk about in anthropology, people who were really rather nasty to each other and all that. I think there's no reason why we can't treat what they do to each other as morally wrong or morally criticizable, even though they may not have our own concepts. But that doesn't mean we can't criticize them.
Yeah, let me put the point in response to your response slightly differently. It seems to me that you're appealing ultimately to the terms of cooperation among people. And the empathy is a guide to thinking about how that might work in practice. I have no objection to that view if what you're ultimately talking about is something about the goal of morality being certain kinds of social cooperation and the distribution of the benefits of that cooperation. If our empathy is selected for in order to achieve that, that's okay. But it's still, that's different from saying whatever the empathy is and the patterns of that constitutes morality.
Yeah. Look, I don't think you can use evolutionary arguments to settle the nature of morality all that easily. So even if empathy was selected for because it allowed certain groups to be more cooperative, the kind of thing that Sober and Wilson say and all that, I don't think that shows the significance of morality, what morality is all about. It's a very nice thing that empathy has allowed us to do that. But I think our moral concepts are not tied to the evolution, okay? Now, so when you talk about the terms of cooperation and stuff like that, I'm not treating that as foundational to anything I'm saying.
So suppose it hadn't aided cooperation. Maybe that's a way of putting Norman's point.
And in fact, it doesn't always aid cooperation.
Right,
okay,
right.
There are times when your empathy with the harm suffered by your family at the hands of some third party are going to make for divisiveness and anger and stuff like that. Okay, so that's an interesting case. And in the human instance, it may well be that we're not getting as much cooperation as all that. However, I don't think that the solution to that problem is less empathy or some other solution. I think there are times when we're in a kind of loggerheads with one another, as in wartime, for example, and empathy is not going to give you the answer. And if there's a history of what are those warring families, McCoys and Hatfields. If there's a history of that, empathy is not going to get you necessarily out of there so easily, okay? But what I do think is this. If somebody hurts those you love, okay, then anger felt in response to that is a morally acceptable response. I'm not going to be a goody-goody about that and say, oh, it's not morally acceptable. So it's a very precarious thing, our civilization, okay? And I don't think the criterion of what morality is depends on how successful it is in insinuating itself. Look, moral education is tough. I was talking about, the nice side of it, to have the father and the mother telling the child, don't hit little Billy, you hurt. But look, there's also the fact that our schools, because of jingoistic reasons, chauvinistic in the original sense, reasons would never teach, for example, that America has done dirt to a number of other countries. That could actually sensitize us to be a more caring and morally decent nation. So I think there are two questions. One, how much prospect there is that we're going to improve morally and that we're going to be in a good situation with each other, and what is the criterion? In other words, I agree with Ronald to work to this extent. Morality is not our mirror, it's our judge.
Let me squeeze in a question as the moderator. One is to Stephen, to Michael, and it is, so we've mentioned in the previous session epistemic explications of probabilistic terms, and we've mentioned both in that session and Caspar in this session, different ways to make sense of some sort of objectivist approach. Do you have any thoughts, you don't have to have any thoughts, on whether the factors that you said from your frameworks make the bias relevant, empathy and some aspects of second personal obligations, respond to the epistemic non-identifiability, or rather to some objective, already determined kind of factor? Question to Caspar is it really counterfactually open what will happen if I flip the coin, given that I will not? If I flip the coin, what will happen? Well, we'll be in the nearest possible world in which I flip the coin. That possible world has a certain history. It's also a deterministic world. There is, from some perspective, a fact of the matter on what will happen. Of course, we don't know it, but it's determined.
Why don't you go first? Yeah.
So you said the nearest possible world. Possible worlds are many, and it may be that there's no nearest one in which I flip the coin. It may be that for any one in which I flip the coin and it turns out heads, there's one that's as near in which I flip the coin and it turns out tails, and vice versa.
So there may be several nearest possible worlds. Is that what you're saying?
Not nearest, no, because if there's a nearest possible world, it's a nearest possible world. So it may not be a possible world in which I flip it and it turns out tails that's closer than all possible worlds in which I flip it and it turns out heads, and vice versa. And in fact, why would you think that there was, that when we looked at the ever closer possible worlds, we finally, as we came to it, we found a sphere around the actual world, right, of worlds in which I flip the coin, and in every world in this sphere, it turns out tails.
My thinking is there is a nearest possible world, in the nearest possible world where I flip the coin, the history of that world will determine how I twist my hand, etc., since that will determine whether it's heads.
I think that
the latter is
right off the bat, you said in the nearest possible world in which I flip the coin, and there's no particular reason to think there is such a world.
But sometimes there will be. So sometimes it will not be.
Well, what is it about the actual world, the structure of things in the actual world, that, for example, makes a world in which suppose that for contradiction, just suppose that there was a nearest possible world in which I flip the coin, and a possible world is now understood in a fully fine-grained Lewisian thing, right? And here's the actual world, and here's this world in which I flip the coin and I impart 6.4387 newtons of force to it at an angle of 27 point something degrees at exactly this time, and so forth. What makes that relevantly closer to the actual world than a world in which I impart a force of 6.75 newtons at an angle of 27 degrees, and I get a tail? There's nothing about the actual world that makes the first kind of world more similar to it than the second kind of world. That's the view.
Unless there's a truth about if you were to flip a coin at all, you would have flipped it in that one.
Yes, and so you could be, epistemicists about indeterminacy could just sort of stipulate. You're Williamsonian about this. Sorry, this is abstract philosophy, but you could just sort of bang your fist on the table and say, for strict methodological reasons, we need to make the assumption that there's always a nearest possible world in which that assumption seems to me unmotivated.
Let me, the other part of your question or questions, and then Steve can speak to it too. I think that an approach, a sentimentalist approach, emphasizing empathy, has to think a lot about issues of probability and how they affect our empathic responses, okay? Now, I think we're going to have to, I don't think we know the answer. I mean, they've done a lot of studies of how perception and contemporaneity affect empathic response. And lots of studies, Martin Hoffman talks about that, there's whole literature. I don't think there's been as much on probabilistic consideration. I think we need to do that. But then we shouldn't just take everything at face value. But we should, you know, the way so many neuroscience experiments get just taken at face value, I think we've got to think long and hard about what they mean. I do think that the greater probability of harming someone or of being able to rescue them, you know, or the greater of their being damaged or something like that, will affect, okay, our empathic responses. But how it does it, and whether there are interfering factors that are really not empathic, I think we need to do more study of that.
So let me just say a little bit about what you asked here. So it does seem to me that, so the framework I'm elaborating starts with the idea of persons as sources of claims. And I do think that once you start to think in that way, then you might be likelier to end up with a person affecting idea than with a consequentialist outcome idea. And so I'd be interested in the way Caspar's thinking about it, and I think I'm convinced by what he said that it can make a difference in this way. So in principle, I'd be friendly to that way of thinking about it. Likewise, when Norman was arguing that concentration of risk can create a greater claim, well, that's a thought that resonates in my framework. I don't have any worked out views on these things, and I'm not trying to work out views on these things, but I think the view would have to address those kinds of questions. It's a great question.
So I have a just open-ended question for Steve, which is, how does your view cash out on a view about either pairwise comparison or whether the numbers count? And you can either answer that or not. But I have a question for Michael that follows up on Norman's, and this may just show that I don't have sufficient empathy for Hume. But I would have thought that you'd make a very careful distinction between what explains morality and what justifies morality. And we could all agree that as a predictive matter, if you don't have empathy, you can't have a fully good set of moral judgments and actions. If I have brain damage that kind of knocks out my emotions, I'm going to be morally useless. We can say that as a matter of motivation. We predict that if you don't have a sufficient kind of empathy, you won't be properly morally motivated. But it seems as if when you actually get to interesting questions, you want to know whether or not my feelings of empathy justify certain actions or not. And we can surely see how cases where our empathy is hardly incorrigible, right? I can put before most people pictures of beautiful little puppy dogs and manipulate their empathy so that they will let not particularly attractive people die. And what are we supposed to learn? What we're supposed to learn from that is, yes, you're absolutely right about causation, about motivation. We absolutely need empathy, but that doesn't actually cash out into thinking that the empathic feelings that we actually feel are justificatory in one way or another.
Look, there is this tendency, forgetting the puppy dogs for a second, to respond more sympathetically or whatever to people who are good looking rather than people who are not good looking. Okay? Now that is a tendency, but my criterion for right or wrong action is whether it shows fully developed or full empathic concern for others. It seems to me that once you get past childhood, you realize that people who are not so good looking actually suffer from that a bit. So I think actually a fully empathic person might really actually prefer, there might be an initial thing. So I think the remedy and the solution for biased empathy is more empathy and fuller empathy, okay?
So so I actually don't have a view about questions at that level. I just see myself as working at the meta-ethical level, trying to provide a foundation for views like Scanlon's or like Rawls's rightness is fairness, as elaborated in Theory of Justice, without prejudice on which is the right way to go on that. I do say that, I do think, though, that, I mean, Parfit has some interesting things to say on what matters that criticize the idea that the numbers don't count, and just the pairwise comparison idea. And it does say what a contractualist could say. You might think, for example, that the numbers do count and that those who are worse off have a stronger claim, a weightier claim. So you could give a kind of priority within the framework. And I find that actually pretty congenial, and I don't see why. I mean, the restriction to personal reasons and the pairwise comparison, I'm not fully convinced of. But, yeah.
So question for Michael and then for Caspar. So in response to an earlier question, Michael, you drew this distinction between policy and then sort of individuals faced with particular situations. And you said of the case where, say, someone comes into a hospital with this need, we shouldn't jump the queue because, look, we've made this promise to abide by the waiting list. Well, I think there are limits to what promises.
Can you speak up a little?
Sorry. So you can't jump the queue, right, because you've made these promises. I think there are limits to what sort of promises you can make on an approach which focuses on empathy, right? Because suppose that we say, look, we've made this commitment to, make it the case that you have to buy insurance for us to help you, if say or you have to wear a helmet, because we don't want to incur this cost on society of having to take people to the hospital who had motorcycle accidents without helmets. And then so, here we are, the distress call, and we say, I'm sorry, we've made this promise and it has this policy-based justification. But I think in this case, what we might say is, well, actually, even though it would maximize, the number of lives saved for this amount of money that's used, and we have, all sorts of other demands on our money, these are certain commitments that we can't make, given that it would result in our having to, not send the ambulance out when someone who didn't wear a helmet is, sort of bleeding to death on the side of the road. And for Caspar, it's not so clear to me any longer whether this view that you were espousing actually distinguishes wheel and dust so much, because you were saying, sorry, and I'm sure that these are a bit more vivid in my mind than other people's minds.
Can't you see the wheels and
but so you were saying, look, in this wheel case, if you do choose the thing that sets the indeterministic process off, there is this fact that there will be this one flesh and blood person who will die. That's going to happen at the end of the day. But this is also true of whomever ends up dying. And we know that someone will end up dying, this flesh and blood person. He wouldn't have died had you not done the wheel thing, right? So then I wonder, what is the difference any longer, given that we know of whomever will die, that someone will suffer this great harm, and that person wouldn't have suffered the harm otherwise. What's the big difference between that case and the case where it's just determined who that person is? And
let me suggest that we have responses from Michael and Caspar, and if Steve cares to say some final words, great. And that will kind of end this conference, and we could reminder we can meet at 9 o'clock after dinner, stretching our legs, etc., in Dan's house, which is 54 Hammond Street in Cambridge.
Look, I think I dispute some of your facts, but are you supposing that I think sheer numbers don't have any weight for empathy? They certainly do. Okay, and they can even overcome deontological restrictions in the case where the numbers, really pile up, and it's, and that's a familiar feature of ordinary thinking about morality that I think is preserved by a kind of sentimentalist approach too. But look, think about the difference between having a policy that no one who refuses to wear a helmet riding a motorcycle will be helped in hospitals. I mean, that's heartless. We don't believe that, okay? And that's partly because we don't think the results are going to be good to have that. We know that a lot of people are going to be irresponsible, okay? And, you know, so in terms of our sheer sensitivity to human good, we're not going to do that. Whereas the alternative one that you mentioned and that I talked about, you have to be at the top of the queue to be helped. That's not heartless.
Right, okay, so sorry, wheel and dust. So if you initiate the wheel, the bowling ball comes out and hits someone on the head, suppose there's you, Michael, then it was very bad for you, what I did. It was very bad for you. Of course, it was very good for the person who was otherwise going to be killed, say, Nia, right? Absolutely. The relevant feature of the case is if I don't do that, suppose I don't do that, then what I do is, so I don't initiate the wheel, right? Then what I do is very bad for Nia, and it's not good for not very good for anybody, because there's nobody such that,
For whomever.
such that they would have been killed had I initiated the wheel.
Whomever gets killed if you initiate it, it's very good for that person, right? Because he won't get killed if you don't initiate the process.
It's very bad for that person, yes.
Right, so what's the difference then? Yeah, it's very bad for whomever gets killed if we initiate the indeterministic process.
Yeah, it's terrible for that person. If I initiate the indeterministic process, that's going to be very bad for the person who the bowling ball lands on. Okay, and it's going to be very good for Nia. But now, suppose the other way, things go the other way. Suppose I don't initiate the deterministic process. That's very bad for Nia, and only quite good for everybody else, because there's nobody there such that they would have died if I had initiated the indeterministic process.
You don't want to say they're very good for whomever would be killed.
For whomever, but there is no such person. That isn't a person. There is no individual like that. Look, I'm arguing. I agree with you. I agree with you. I think this consideration, I can see, it follows from these principles and this way of thinking about the way that individuals get affected by actions, that yes, we should be attentive to this distinction. I think that we shouldn't be attentive to this distinction, because I think that in kind of the cases rather like the ones that you were suggesting, we can imagine cases in which that runs afoul of norms of benevolence and like rationality. So if I just cared about each person and I wanted to maximize their chances, it could be that I would be in a situation in which it would be better. I would be, just in virtue of caring about each person and wanting to maximize their chances, I should do something such that if I do it, I will have ended up harming somebody very badly. And if I don't do it, I won't have ended up harming anybody very significantly at all. And so I think that these kinds of principles run against the idea that, well, being moral is about wanting the best for everybody and trying to maximize the chances of survival. And so I think that when they run against that, when there's that conflict, I tend to go with the idea that being moral involves wanting the best for everybody, rather than with thinking that being moral involves having failed to do significant harm.
Right, and I think that's a deep point. I think what it reveals is, if you think of morality on a sort of model of rational benevolence, then you end up with some form of utilitarianism, maybe act utilitarianism, or at least act welfarism or something like that. And if you start with empathy, it sort of depends on how you think of empathy. I mean, if you think of empathy as the thing that attunes you to how bad it is for other people and then can give rise to sympathy, then you could go in the direction all the way to Caspar, or you could stay where Michael is, where it's not fully rationalized sympathy. It's something else that stays where we are as, it's Hume rather than Hutcheson.
Right.
Because Hutcheson also Hutcheson is Mr. Rational Benevolence, right? Hutcheson is Sidgwick avant Louis, and he's a sentimentalist Sidgwick, okay? But what underlies this other way of seeing things? It's not benevolence, it's respect. And when you focus on people from the perspective of respect, you're focusing on them as sources of claims. You're seeing them as having a certain kind of authority or a certain kind of dignity. And so that's the deep difference. And so we have the three of us.
Yeah, let me just make a little coda here.
Yeah.
The notion of respect and autonomy that goes with it, that Steve is talking about, is different from the notion of respect you get from empathy. But empathy can develop its own forms and notions of respect for autonomy. That's something I've discussed in my work. You get a real opposition in terms of what counts as disrespectful, okay? But it is an alternative version of respect.
Thank you very much, everybody.